From WisPolitics in Madison, you're listening to Capital Chats.
It's Capital Chats. I'm Joshua Irvin, a reporter for WisPolitics. This week, I spoke to Mike Roberts, a physical therapist running as a Republican in Wisconsin's 5th Senate District. He's expected to face State Representative Robin Vining in November. I talked to Mike about how he thinks Wisconsin can improve health care access, reduce its property tax burden, and reform law enforcement, and how to pay for all of those things. I hope you enjoy.
Mike, thank you for joining me.
Thanks for having me.
I want to ask, you want to be a state senator? What is it you bring to the legislature?
Yeah, so part of it is the 5th Senate District. It's very important to me. I was born in Brookfield. I was raised in Pewaukee. I built my business, my healthcare business in Wauwatosa. I obtained my undergraduate and doctorate degrees in Waukesha, and that little sliver of Waukesha, that's right where the Graduate Center was. So, and then today I'm raising my own family right here in the district. So for the last 15 years, I've worked as a doctor of physical therapy and a business owner, helping people solve problems and really improving their quality of life. When I first started as a physical therapist in Wauwatosa, right out of school, I worked for another practice, and I would see anywhere between 20 to 30 visits per day. My record actually one day was 69, which the docs on my staff now, they won't even see 60 in a week, let alone 69 in a day. So I saw how broken our healthcare system was, and that we were being rewarded on visits and volume, not on value and outcomes. So I did something about it. I started my own practice, and really over the last few years, and the thousands of patients that I've been fortunate enough and blessed to be able to treat throughout the entire district, I've watched families struggle with rising costs, higher property taxes, doesn't matter which end of the district you're on, how expensive and complicated healthcare is, and the concerns about public safety in our children's education. And just like I started my practice, I saw a problem. I'm seeing a problem in our community right now, and I'm doing something about it. So ultimately, I'm running because I believe Wisconsin needs more leaders with, I'd say, real world experience and who are focused on results instead of politics. So my goal is, as far as becoming the next senator in the state, is simple: lower the cost of living, improve healthcare when it comes to cost, quality, and access, not just one of the three, but you have to have all three, improve educational outcomes and workforce readiness, and ultimately keep our community safe. Like, these are things that everyone on both sides of the aisle want.
Okay. Now, as a healthcare professional, I want to ask you, you've talked about incentivizing and paying for prevention and for expanding access to preventative care.
Mhm.
How do you do that?
Yeah, so I've done it within my own practice. For years now, I've worked closely with all of the police departments within the district, and I'll just kind of use this as an example of how we would implement it within the state. So I would come into the police departments. I would do roll call, and it's for all 7 districts with Milwaukee Police, with Wauwatosa PD, West Allis PD, Brookfield PD, you name it, Waukesha PD, and I would come in. And I'll say to all these men and women in uniform, I say, all right, how many of you have had lower back pain off to the side? And of course, half the room, they raise their hand, and I'm like, well, I've said this to many hundreds, if not, 1,000 plus officers. Like, if I could have just gotten my hands on you months ago, we could have prevented this from happening. And really, that's why I started my practice too. I looked at the system was, we are very reactive in healthcare instead of being proactive. And if we can get ahead of these conditions outside of even just orthopedics, if we look at just within our state, the amount of money that we're spending on chronic preventable conditions, we could save a whole lot more if we could invest in that. So, when it comes to how do we implement and improve access within healthcare within our state, I think the first thing I always say, it's kind of like physical therapy. People typically don't love physical therapy because it takes a lot of work. A lot of people, they'll say, hey, you know what, doc, can you just give me a pill and fix this? I'm like, well, I can give you the pill and fix the symptoms, but that's not going to get to the root issue of your conditions. And I have a feeling that it's going to be a lot similar within the legislature, where people are going to say, hey, Mike, you're in. What are you going to do day one? It's like, I know they're going to want to see results right away. So when I look at how do we improve cost, quality, and access right off the bat, it's reducing the amount of administrative waste. Even within my own practice alone, I don't even want to add up the amount of time, money, and energy that's been spent on administrative waste, pulling my docs away from patient care. Again, you want more access to care? Let's get our docs back treating. If we want to lower costs, let's stop paying for all this administrative waste. If we want better quality, if you're with your patient, that's only going to improve quality, more time with your patient. So when I'm looking at, day one, what do I want to do to improve cost, quality, and access? It's reduce the amount of administrative waste that we see, even within my own practice, let alone these large hospital systems. Then, we can look into price transparency. That's another huge one too. If we're looking at prevention, and like this is my ultimate, goal would be to, if we just use, for example, the 12.5 plus billion dollars we spend on Medicaid in the state, 75% of those costs are chronic preventable conditions. And again, there's so many ways that we can incentivize individuals instead of mandate to become healthier. 60% of those costs are type 2 diabetes. We can do a lot with that. And so there's a lot of states out there, even within here in the Midwest, especially when it comes to SNAP benefits, where they did double up bucks, where buying fruits and vegetables and buying healthier foods. Again, if we can have people eating a healthier diet, lose weight, and lower the prevalence of type 2 diabetes, that's going to be a huge cost savings for our state.
We're talking about kind of incentivizing healthy activities, healthy
Yep.
lifestyles in order to reduce that need.
Yep.
Okay. And you have said, that you can, you said that, you've said that expanding access to this preventative care, that it can be done without expanding Medicaid.
Mhm.
Now, how do you, expand access to preventative care, outside of, a medical setting?
Mm. Do you mind repeating that, I guess,
Sure.
as far as, yeah.
I guess, you talk about expanding access to preventative care,
Yeah.
you talk about
Yep. Yep.
incentivizing lifestyles.
Yes.
How do
Yep.
you do that outside of, medical channels, with the fact that so many Wisconsinites are not going to be have access to programs like Medicaid going
Mhm.
forward?
Well, and hopefully that they are. I mean, I'm not looking to reduce the amount of people on Medicaid. And again, there are certain qualifiers to be on Medicaid, to be on Badger Care, and people that need it should have it. I think a lot of, especially my opponent tries to say that I'm trying to cut access, and that is completely false. What I've said is her only position has been that she just wants to expand access. But what we need to do to have the best medical healthcare system possible is to improve cost, quality, and access, and certain things like I was talking about before. So as far as, I would hope that those don't, that no one does lose coverage. And again, for that to happen, I guess, in what areas are you saying they would lose access?
I guess when we're talking about preventative care,
Yeah.
for me, that means, a checkup with a doctor. You need a doctor or a medical
Yep.
professional to tell you to take these steps in order to take those preventative steps. I guess
Right.
how do you,
Yeah, well, I
communicate
would
that?
say from on the medical side of things, and I've even advocated for a lot of postpartum health and a lot of other things through the American Physical Therapy Association out in Washington, D.C., and especially uh, with postpartum care, that was one where the doctors just didn't have a good understanding of how essential it was to provide that care for women after birth. Same thing here. How many docs will send patients our way? They don't know that much about physical therapy, how much of a cost savings we can provide the healthcare community. When it comes to nutrition, when it comes to exercise, my business, we even have a program for osteoporosis where how many of our patients are able to get off medication because of the program that we've implemented. So a lot of it is you don't know what you don't know. And I would say as far as expanding access, it's about getting the word out. It's about educating even the doctors. And so I don't look at anyone being cut from Medicaid. I think it's more about opening up the opportunity for anyone that is on it, and even with private insurances too. I think as a state and as leaders within our community, it's our responsibility, especially on the healthcare side of things, to get that word out there. Even within my own business, we try to do it. We go into the police department, we go into different businesses, and we educate on the benefits of physical therapy. It should be no different as far as nutrition, regular exercise, or anything in between.
Okay. You've also said you'd like to reduce Wisconsin homeowners' property tax burden. Uh,
Mhm.
how do you think the legislature can do that?
Well, I think, as far as when it comes to property taxes, we have to provide relief without sacrificing quality services. Wisconsin remains one of the highest property tax burden states in the country. So we need responsible spending. We need regulatory reform that encourages economic growth and policies that help local governments operate more efficiently. That's how we're able to lower property taxes. Um, you know, Other bills, this most recent bipartisan bill, unfortunately, Robin Vining, my opponent, she supported Governor Evers' 400-year property tax increase, and then in this most recent bill voted no. She talks all the time about affordability and more funding for schools. This bill did exactly that, along with a number of other things like no tax on tips or overtime that would have put money back into her constituents' pockets, but she voted no. So, when it comes to lowering property taxes, how can we reduce that burden? And again, that's by, bills like this that would have taken that pressure off.
Now, you do bring up the unsuccessful effort
Yep.
to spend down some of the surplus.
Right.
That would have addressed property tax relief, at least in the short term. In terms of a long-term solution, though, what do you see as a way of addressing that burden? I will note that school levies make up nearly half of the
Right.
property tax that Wisconsinites pay.
Right. Yeah. Well, it's overall spending. When we look at the budget and how much we're spending, each biennial budget that keeps going up, how do we lower that? Where is the money ultimately going? So when we look at the regulatory restrictions in this state, we're the second most in the Midwest, we're 13th most in the nation, and that's when we're like, I would truly love to think that myself and Democrats could come together and say, hey, listen, let's find 10% that we can all agree on, 10% that are either outdated, that are duplicated, that are inefficient or ineffective, and let's eliminate those. And I know there were 4 bills as far as kind of a red tape reset, again, that my opponent voted no on all 4 of them. Again, that's money back into the state's budget. And again, if we're looking at how can we use that money in different communities, well, we need to have it. And if it's being spent irresponsibly, then that goes on local property taxes and on the citizens of each district.
I want to turn to the question of law enforcement. You support both increasing staffing for law enforcement, expanding mental health and crisis response services,
Mhm.
as well as prison reform to
Mhm.
encourage successful reentry into
Yep.
society. These are all endeavors that would cost money. So I guess I come
Right.
back to the question of, how do you pay for these kind of initiatives, for these incentives to
Right.
improve criminal justice in Wisconsin?
Well, it's almost the same thing as healthcare. Yeah, it's and no different in business. Like sometimes it takes spending money to make money. And again, we're spending a lot already. We're spending a lot in healthcare. We're spending a lot because of repeat violent offenders in this community, because of retail theft. We've got, Mayfair Road in my district. We have Brookfield Square Mall in my district. So yeah, when it comes to, law enforcement, I've like I was saying before, we've done a ton of pro bono work. I've gotten to know all the chiefs in this district. I've gotten to work with most of the officers I've gotten to know personally and what they deal with on a day-to-day standpoint. So the thing for them, and I hear this all the time, they're sick and tired of arresting the same people. It really, it makes up a small, the number of offenders isn't that big, but it's these repeat offenders. And I was just with the chief of police in Wauwatosa yesterday, and he was talking about too how the majority, about 80%, I believe it was, of offenders here in Wauwatosa don't even live in Wauwatosa. So again, there's a lot of things that we can do, and even without spending money. My meeting yesterday was actually about research that Wauwatosa PD is doing, and they call it hotspot policing. So they're doing research. They're finding how do we use evidence-based practice within law enforcement, just like you do in healthcare, Mike. So that's one thing where they have a crime harm index where they actually show how they can lower crime, how they can lower costs within the system, and they can actually put a dollar amount to that.
Okay. Mike, thank you very much for taking the time.
Thank you so much for having me. I truly appreciate it.
Thank you again to Mike Roberts and to you, the listener. For WisPolitics, I'm Joshua Irvin, and this has been Capital Chats.